I feel good about helping people. Why would I tell someone else to volunteer at Enloe? That's pretty simple. I see it every time I volunteer. There's somebody who needs help, who benefits from a volunteer, whether it's me or one of the others.
My skills are working with people, so I'm a people person. And staying home was just not my bag after retiring. So I needed to be out in the community and doing something useful and making me feel good at the end of the day.
I volunteer on the third floor. Human interaction, I think, is a very important part of the program. We realized when we were here as visitors that there are a lot of people that are patients in the hospital that may not have family here in the area, may not have friends here in the area that can visit with them. Good. I'm Ron Janis. I'm a volunteer here at Enloe. We ran into that basically by accident when we were visiting our son-in-law. In reading the article about the Patient Ambassador Program, basically you visit with every patient on the particular floor you're assigned and hopefully make them feel more comfortable, because there's a lot of long days, I'm sure, when they're sitting in a bed in a hospital that goes by real slow.
They have to see it to believe it. And that's what I think the instruction to get people started, and it's more or less they have an overall view of everything before they really get going, and I think that has helped probably draw in as many volunteers as there have been coming.
Training that was given to us, not only classroom training, but on-the-job training at the hospital itself, shadowing some other volunteers. That way, when we were done with our formal training, we were very comfortable to be able to handle it on our own. I can't remember one time when I have been put in an awkward position by a patient or staff or anyone when I've been a patient ambassador. I've been very comfortable all the time, and you get good feelings of talking with the individual patients.
Every day is a new experience, and every day's something else. It can just be a smile from a little child because, you know, they don't know why they're there. And I find that most rewarding when I can go into a room and make a little one laugh. My career was raising 2 children. Volunteering in a school with your children is very rewarding in the sense that you want to know what your children are doing. You want to know who they are with. Whereas volunteering in a hospital, you're wanting to be there to, even if it is for 30 seconds, maybe give some happiness to somebody who's having a very rough time. And they so appreciate just having you there. I think the first day of being set free on the floor, you're basically on your own to do it how you want to do it and what you feel is best.
Oh, she's up.
It seems like it just gets easier and more comfortable, and you sort of slide into your little niche of how you handle the patients and treat the patients and work alongside the staff.
Oh, that was my next short.
Working with the staff as we talk about it, they are just extraordinarily nice. And I'm a friend that comes in on the days that I come in. Oh, here's Marge, here she is, here comes Shorty, here comes this. They know that I'm there for them. I want to be sure, she asked for apple juice, and I want to be sure that they think so much of us that it's very difficult not to love them all. One of the things that made me feel real proud is that up on the floor that I do the patient ambassador, the case management workers asked me one day, they said that they just know what I do up there, and they feel that I do a good job, and would I stop in the morning when I'm there and talk to them, and they will give me particular rooms that they'd like me to go in, and in case for some time I don't get into all the rooms, that I would start with those rooms that they think could need a little cheer from Marge.
Gotcha. Gotcha.
How do we interact with the staff is different every day in every place. Hey, how are you?
I'm doing great, thank you.
The nursing staff and hospital staff is busy. They're intense. They're constantly moving. They see people that are being positive because they care, and I think it peps them up. People here are in need, hurting, many of them, most of them. They didn't come here because they wanted to. Number there. Exception is maternity. They all smile on the way out. But I feel good about helping people, encouraging people, and it means a lot to them. And it says, gee, these people are doing it because they want to. Hello, Gary.
I started to be a volunteer almost 5 years ago. Our team is just a real small knit group. We socialize together, we talk about our families, and we can read each other's thoughts. You know, when I see one of them look at somebody that needs help, I know how to take care of the problem, or if that's not their duty, I would take care of it. I continually talk to people about being volunteer. Even the people that come into the hospital, they'll ask me, what is it like? And I just tell them it's a great social group, as well as helping the hospital out, that it's not scary. And I tell them, you know, they think maybe they can't do some of the same things I do, but I tell them there's lots of different things in our volunteer group that can be done. If maybe they don't want to commit to you know, a schedule, they can come in and do other things just periodically. I'm always selling the volunteer job. My mother passed away at the hospital. She was very old, and I see daughters wheeling their mothers into the hospital, and I'm going to cry. And I see myself doing the same thing. And I'll pat them on the back or something and say, "You're a good daughter." And it's a way of giving back. It makes me feel good that I'm doing it.
I did not volunteer previously, and this is my first time at volunteering, and I have been so amazed. I thought basically it was a candy striper with a cart and some candy to visit kids. And once I became a volunteer and realized just the vast area that we could be of assistance in the hospital, I now find it very easy to tell friends and to recruit friends into the hospital volunteer system. It just is, it's a wonderful thing to give back to the community. So much gratification, far more than I ever expected.
Is there anything I didn't feel like eating?
There are so many days that when I leave the hospital, I'm so grateful to be a volunteer, to having been at that particular position on that particular day. I had a lady up on our patient ambassador floor, and her husband was very ill, and as a matter of fact, they started calling hospice.
From the 4th floor.
And I was there that day when all this was happening, and I tried to have this lady, who is obviously the wife, try to go down and get something to eat. I tried to bring her coffee. I tried to get her a cup of tea. She did not want to know. She wanted to be right at his side so that she could know exactly when the doctors were coming in, when the nurses were coming in. Eventually, coming towards the end of my shift, I thought, I just have to try one more time. And this time I took in 2 warm blankets, because she was a wee little person, just like you, Marge. And I wrapped her up in these warm blankets, and the look on her face, I'm going to cry.
I know.
And the look on her face was just so precious. And eventually I got through to her that we could look after her as well. And it was the best thing I could ever have done, was just bringing her 2 warm blankets.
Frankly, I was looking for a different place where I could come and volunteer that was a positive atmosphere and where people were making a difference and where there was a sense of community and helping supportive atmosphere from all sides of the group.
The best part of becoming the patient ambassador is that you also become a good listener. She has to drink this medication every 30 minutes, so she does some crossword puzzles and drinks her medication and does more crossword puzzles. And she was waiting for her daughter to bring her some, but it's not till her lunch hour, so we went and found one and we'll take it down to her.
I think that's the thing that Enloe deserves the most credit for, is that they really have a well-established network of people that are doing the volunteering. And I think, you know, once you're here and you see what's going on, the need is so great, and the opportunity to make a difference is here, and you can make of it what you want to. I try to come in, keep busy, and be positive, and make others around me positive and have a good day at the office.